Today we will deal with the drug amiodarone. So the trade name of amiodarone is cordarone. The functional class of amiodarone is antidysarrhythmic class 3. Why it is specifically told that it is a class 3 drug? Let's see in further video. The chemical class of this is iodinated benzofuran derivatives. So come on, we discuss the indication for this amiodarone. The indication for this is hemodynamically unstable ventricular tachycardia. So if the patient has came with you and you have put it in the came in an emergency ward, the patient heart rate like he is in ventricular tachycardia, so in your mind it should be like which drug should be given, that is amiodarone. And it is also used in supraventricular tachycardia and even in atrial flutter. Guys, you might be knowing in atrial flutter how the ECG wave is. It is literally you can't even see the P wave, you can't see QRT, there is nothing, you can't you can't see. It is like a rough diagram which is drawn like a super, it's you can't identify the QPT waves. And then next is the patient who has came with the patient is having suddenly got it into cardiac arrest, then in that time also amiodarone is used. Coming to its mechanism, so the mechanism of action and of amiodarone is the prolonged duration of action potential and effective refractory period, non-competitive alpha and beta adrenergic inhibitions, and it also increase the PR and QT interval, and it also decrease the sinus rate. Because of increase in pacemaker, like because of increased activity in the sinus, what happens, that is like tachycardia, the patient is suffering from tachycardia because of that overactivity of sinus node. Now what does the amiodarone will do, it will decrease the rate of the sinus and it will also decrease the peripheral vascular resistance. Now coming to the pharmacokinetic, the onset will be 1 to 3 weeks and the peak will be 3 to 7 hours. So what does the onset mean? When the absorption curve, like for example you have drawn a graph and the absorption curve crosses that minimum effective concentration line, so that's what the onset is. And for this amiodarone drug, the onset is 1 to 3 weeks and the peak is 3 to 7 hours. That means if you have given the amiodarone drug to the person, there will be 3 to 7 hours there will be increased level of medicine in blood. That's what the peak means. What is half-life? The half-life for this amiodarone is 26 to 10 day. This drug is increased in the absorption, or the pharmacokinetic is increased in geriatric patients, and this amiodarone drug is metabolized by liver. So usually any drug is metabolized by liver. Some of the other is metabolized by some other organs, but mostly liver does this. And next is contraindications and precautions. So for the pregnancy time, the drug is contraindicated, and for cardiogenic shock. Why for cardiogenic shock it is contraindicated? Basically in cardiogenic shock, there is no work of almost there is a shock occurred in the heart, so the heart is not working properly, the sinus node is not working properly. So if you are further giving amiodarone and decreasing the sinus rate, so obviously there will be the patient will die obviously. So it is contraindicated for cardiogenic shock, and it is also severe sinus nodes of dysfunctions and bradycardia. Basically for tachycardia we used to give amiodarone. If for what the reason we are giving for in tachycardia, to make that patient or to make it bradycardia, not in bradycardia is something a disease, like to make it normalize. If you are giving it like to decrease it, but if you are giving in bradycardia to decrease more, then it is like almost you are making the patient more worse, and also in second to third degree AV block. Next is the adverse drug reactions and the side effects. So it can cause hypotension, fatigue, bradycardia, tremors, and coagulation abnormalities. The drug interactions, let's see. It will increase like bradycardia, sinus arrest, AV blocks, beta blockers, calcium channel blockers, and it also like anticoagulant effects, that is dabigatran, warfarin. Dose may need to be decreased. The routes and dosage, like in while orally, the loading dose will be 800 to 1600 mg per day for 1 to 3 weeks. Then it will be gradually decreasing to the dose will decrease to 600 to 800 mg per day. For 1 month it will continue like 600 to 800 mg per day, and then after the like it is the patient has maintained it, then the patient will have something 400 mg per day. If the patient is like if the patient has came with the ventricular tachycardia, so obviously in ward or obviously in hospital we give through IV. So the loading dose will be 150 mg over the first 10 minutes. So basically the 1 ampule, that is 1 ml contain 150 I think, and for 10 minutes we have to give. Then slow to 360 mg over the next 6 hours. It is also in the form of tablet. So obviously if it is in an oral form, so it will be a tablet, and in an injection form, that is the ampule contain 3 ml and each ml contain 50 mg. So it is basically 150. If a doctor has told you to load 350 mg, so that you will be taking 2 ampule, because in each ampule 3 ml is there and 1 ml is 50 mg. I hope this is clear to you all. Next is pharmacodynamic. Actually it blocks potassium currents that causes repolarization of the heart muscle during the third phase of cardiac action potential. As a result, amiodarone increases the durations of the action potential as well as the effective refractory periods for cardiac wall myocyte. What does it basically, like it is basically explaining that it will just slow down the sinus node, and it will basically decreases the cardiac function, and somewhat in a simpler way it will decreases the cardiac function. Not a cardiac function, it is something a different word I'm using here. Like it will just prolong the repolarization state. So like you will get a proper PQRST wave. You can see it in the ECG. Before it was like in atrial flutter, in that all thing you can't even see the PQRST wave. So here you can see it. And what is the nursing responsibility? As I am a nurse, what all responsibility you will be taking? So if you are like if the patient has patient has taken amiodarone, or before giving amiodarone you have to take ECG to check whether the patient is suffering from atrial flutter, and after the amiodarone, after giving that also you have to check whether the patient has came in normalized or not. And then we have to check the electrolytes. Then we have to see the chest x-ray whether there is any hypertrophy or anything. We have to see the chest x-ray. In the chest x-ray it is very clearly we can see whether the heart size has increased or not, whether it has ventricular hypertrophy, we can see that. And liver function test, is also required, because as I've already told, the metabolize takes place in the liver. So if the metabolize is taking place in the liver, so we have to check whether it is damaging to our liver or not, whether the liver is functioning properly or not. So if the patient is taking amiodarone, what education we should give as a nurse to a patient? So to take this product as directed, it means if doctor is advised, then only we should prescribe, then only you should take this medicine. And you should avoid the misdosed, not to use with grapefruit juice. It can just interact with the dry and can result some wrong. Not to discontinue abruptly, like if some of the reason you are discontinue, it should not be done by you. So this is what about the amiodarone. I hope this drug will be very clear, and hope you will like this